Hello, everybody, and welcome to Weiss. I'm Murray Scheinman. I'm an internist here at the hospital, and I'm going to talk to you for a few minutes about strokes. It's going to be very basic to start out. The body needs oxygen to survive. You breathe in oxygen in your lungs, and then the heart pumps the blood, which carries the oxygen, all over the body. Just basic physiology. The heart is pumping the blood with the oxygen to the various organs, the muscles, the kidneys, the heart, and the brain. If there's a blockage of the artery in the heart and the blood's not getting to that area and the oxygen's not getting to that area, we call that a heart attack. That portion of the heart not getting blood and oxygen will die. If that same process happens in the brain, where one of the arteries gets blocked, blood is not getting to that part of the brain, oxygen is not getting to that part of the brain, and that part of the brain dies. And we call that a stroke. If we can catch this, there are two kinds of stroke. The one we're talking about here is where there's a blockage in an artery and the blood is not able to get to that part of the brain. There's also what we call a hemorrhagic stroke, where there's bleeding in the brain, but that's not the subject of the discussion today. This is what we call an embolic stroke, a blockage in an artery, keeping blood from flowing to the brain, no oxygen, and that part of the brain dies. Unless we can catch it early. And if we can catch it early, we can reverse this stroke. And we'll be talking about that later. Weiss is a stroke center where we can do just that sort of thing. Symptoms of a stroke include weakness, slurred speech, mental confusion, difficulty getting words out. I could talk for an hour just about strokes. But the point is, it's a preventable disease. There are things we can do to prevent strokes. Things like not smoking, eating healthy, lowering blood pressure, lowering cholesterol, managing diabetes, just to mention a few. If you have a stroke, then the most important thing is to start rehabilitation or rehab as soon as possible. And one of the key types of rehab is speech rehab. And you're going to hear about that shortly. So that's my short presentation on stroke. If you have any questions, shoot them out quickly. If not, I'm going to turn the program over to Matt. Okay.
Yeah, do you want to see yourself?
Yeah, well, just so they can see. Oh, hi everyone. I'm Nellie. I'm actually the stroke program coordinator. Maddie and I work together. In addition to, I'm a physical therapist, but I also then work with the entire clinical staff in the hospital in regards to stroke care and very specific stroke treatment and measures that we need to do to make sure we provide very good care for our patients. In the state of Illinois, if you call 911 and tell 911 that you or someone that you see is having stroke-like symptoms, EMS has to bring you to a certified stroke center. As you heard from Dr. Scheinman, Weiss is a certified stroke center. Back in 2016, Weiss received that certification, and we've been recertified every 2 years since. In August of this year, we just underwent our third recertification, our fourth certification, stating that we continue to provide good care for our patients with stroke. We provide a full range of services for individuals who have stroke. We actually, in our emergency department, are able to use Northwestern teleneurologists or neurologists over a robot to examine our patients real time, even though they're not in-house, but they use a robot and then the staff to examine the patients. And then we have Northwestern neurology help in our emergency department. And then on our medical floors, we have another group of physicians that provide coverage for individuals that experience a new stroke or need follow-up care for stroke. We provide 24/7 imaging to look at the brain to see what's going on. Our lab is available 24/7. All of our staff throughout the hospital receive very specific stroke training. Clinical staff receive more training, but even non-clinical staff receive training here at Weiss to help identify individuals who develop stroke-like symptoms here in the hospital, because it's not always just patients. It could be a coworker, it could be a visitor, it could be someone walking through the hospital using the bathroom. So we want all of our employees here to be able to identify stroke symptoms and know what to do if we see someone developing those stroke symptoms. As Dr. Scheinman said, we have therapy services. We have therapy available 7 days a week here. We have an acute rehab unit on our 4th floor for individuals who qualify can go to the rehab unit and receive intensive therapy while they're here to get them home. And then we do very regular monitoring and tracking of all of our patients to make sure that we're meeting all of the requirements and our patients get the right care at the right time. Okay, yes, Dr. Scheinman.
Can you speak to that, the timing, why it's so important
Yes.
to recognize and get the stroke
Specifically, as Dr. Scheinman said, identifying stroke-like symptoms, there is an acronym, and Maddie will be reviewing that. But the acronym is B FAST. You maybe have heard the acronym FAST. They've added 2 letters at the front of it. B meaning balance, E meaning eyesight, F meaning facial droop or facial weakness, A meaning arm or leg weakness, S meaning speech difficulty, and T meaning time. So the acronym B FAST. If you identify those symptoms in yourself, a family member, whomever, T means time, get to the hospital as soon as possible. An individual who develops stroke-like symptoms and get to the hospital within 3 hours, maybe sometimes up to 4.5 hours of symptom onset, there is a medicine that can be given to you via an IV to break up the clot if the stroke was caused by a clot, but you have to be at the hospital in about 3 hours. And that's what the research shows. And then that can actually help resolve all the stroke-like symptoms. So if you see someone that had a large stroke and it ended up being related to a clot, if they still have some significant symptoms, likely they weren't able to get to the hospital quickly enough. So that's why it's so important that we get to the hospital as soon as possible to possibly receive the medicine to help break up the blood clot if your stroke is being caused by a blood clot. So that's where that timing is so important. Thanks, Dr. Scheinman. Good question. Maddie's going to get right into it. As Judy said, Maddie's our speech therapist, very well skilled in speech therapy, but specifically in stroke. So we'll leave it to Maddie.
Thanks, Nellen. All right, so moving right along, since we already know what strokes are, let's talk about preventing strokes. So like Dr. Scheinman said, what is a stroke? You can think of it as a brain attack where the blood flow is not able to get to the certain areas of the brain, and then therefore the brain starts to die. How common are strokes? Nearly 7 million people are stroke survivors in the United States. Strokes account for 1 of every 19 deaths. Someone dies of a stroke every 3 minutes and 33 seconds. So they're very, very common. And I think the biggest thing here is that 1 in 4 stroke survivors will have another stroke. So being very mindful that if you've had a stroke before, what you can do to prevent another. Different effects of a stroke. We kind of briefly talked about this. They divided into physical and emotional and behavioral changes. So how they said paralysis or loss of movement on, usually it's one side of your body. Some people have seizures, visual problems, incontinence, pain. What I deal with a lot is swallowing difficulty. What PT, physical therapy and occupational therapy deal with is balance issues and strength. And then the last few here, speech deals with, so memory struggles, difficulty speaking and thinking difficulties. Some of the other things that maybe doesn't get talked about a lot is that it often affects our emotional well-being. So some people often become depressed or anxious, different things that affect regulation of the body, difficulty controlling emotions, things like that. So how can a stroke affect you? So they break it down between left and right. So left side of the brain really deals with our speech and language, our ability to read and write, our behavioral style, our math skills, analysis of things, and our memory. And then the right side deals with depth perception, vision. It's a quick behavioral style, our ability to be like creative, art and music, recognizing emotions, and then also memory as well. Okay, so another review of what Dr. Scheinman had said. What can you do to prevent the stroke? Lower your blood pressure. Normal blood pressure is 120/80. So it would be important to talk to your doctor about that. You get that done every time you go to the doctor, and your doctor would let you know if you need medication to control that. AFib, again, something your doctor would diagnose, but AFib increases your risk of stroke 5 times. So it's good to keep that under control. Dr. Scheinman said smoking as well. So if you're smoking, stop smoking, as this, has different effects on parts of the body.
What about drinking?
That's the next slide. If you drink alcohol, do so in moderation. It says no more than 1 drink per day for women, no more than 2 drinks per day for men. Does that answer your question?
And we understand why that is the difference between men and women. We metabolize things differently. Body densities are a little different. So that's why you do see men and women differences as far as what we should or allowed to have.
Lowering your cholesterol. Again, this is something that they'd be testing at the doctor with blood tests, and your doctor would let you know if you should be taking any cholesterol medication. Diabetes, and things that you can do. We can't really see blood pressure, we can't see cholesterol, but things that you can see and do, exercising daily. So it says patients with previous stroke or TIA, which is a transient ischemic attack, like a mini stroke, moderate intensity aerobic activities such as brisk walking, water aerobics, dancing, gardening for a minimum of 10 minutes 4 times a week, or vigorous activity like hiking, running, swimming for a minimum of 20 minutes twice a week. But always ask your doctor what would be most appropriate for you. Cutting down on sodium and fat, that's all related to our cholesterol. And then this is pretty much a synopsis of what we've talked about, but being mindful of what your blood pressure is, your cholesterol levels, talking about these things with your doctor, increasing fruits and vegetables in your diet, all those good things that the doctor always tells us, right? There's a reason for it. And that's what that says. And then here's that acronym that Nellie was talking about. It doesn't have the B at the beginning, but B fast. So facial drooping, arm or leg weakness, speech difficulty, and then time. Call 911 right away. Okay, any questions about that presentation before I move on to speech therapy specifically?
Are there any other hospitals that specialize?
I think Nellie could answer that.
Yeah, so quite a few hospitals in the Chicago area are primary stroke certified. And then some of the university hospital settings are actually comprehensive stroke certified. Northwestern, Illinois Masonic, Rush, University of Chicago. yeah, some of the bigger hospitals are comprehensive stroke certified.
This way, my heart started,
Yep.
started going.
Yep,
Very
and
bad.
that's a risk for stroke. Yep.
I mean, it was just, I think, call it.
Yep.
Call 911.
Yep. Yep. So EMS, our Chicago Fire Department, and, sorry, EMS, our Chicago Fire Department is specialty trained in identifying stroke, but then also the severity of stroke based upon what symptoms you have. And they know if you score a certain number on a test that they do, they're gonna bypass the comprehensive stroke centers and actually take you to, or bypass a primary stroke center and take you to a comprehensive stroke center. So if you have a very significant stroke that EMS identified, they will actually even bypass the primary stroke center such as Weiss to take you to a university setting, unless it's gonna take more than 15 minutes to get there. They will take you to a primary center first to get you stabilized, possibly give you that IV medication if you qualify, and then transfer you to a comprehensive center, because time is so important. If they can get you even to a primary stroke center within that 3-hour time mark, they'll get you there to then know that they're gonna transfer you. Because if they take that extra amount of time to get to a comprehensive center, it could cost you the ability to have that IV medication.
When I was having a problem with the heart, they.
Yeah. Yeah, exactly. No, we're lucky here in Chicago because so many hospitals, we're dense. There's a decent number of hospitals, and that have the stroke certification. But as they get more rural, it's harder. So that's why it's so important for early identification, because you're not going to get to that hospital in 10, 15 minutes. It could take you 45. So it's just so important to recognize the symptoms right away and do something about it right away.
Any other questions before we move on? Yep.
When I had my stroke, I was working at Water Tower the night before, and I was at Northwestern having a test,
Uh-huh.
and they wouldn't let me go home, and I thought, what's going on? So I finally came in and said, sometime within the last 2 days, you had a stroke. No symptoms whatsoever, nothing. It says sometimes women over 60, it's called silent disease. Because like for me, I didn't have no symptoms. They were baffled.
Mhm. That's the scary part about strokes, right?
But I was
Sometimes we
lucky
can't see.
Because I was at the right place at the right time.
Right.
Because I was already at
Mhm.
Northwestern. So they
Yeah.
admitted me immediately.
Mhm.
Yep.
Very good. All right, anything else? Mhm.
What do you do if you live in a rural area and you're not near a hospital? I mean, not a stroke center, just a little
Right.
community hospital.
So in a lot of rural areas, hospitals that are, that do have that certification, especially in rural areas, will have a mobile stroke unit, which is really cool. So an ambulance will be sent to the patient with the certain testing and medications to start the medication at the center or, at the patient's home, and then bring them. No, that's in only certain areas, but they do exist. Yeah, so that, if you do live in a rural area that has a mobile stroke unit, it's good.
Mhm.
Again, it's just not everywhere, but you just need to get yourself to the hospital as soon as possible, if not. But no matter what, always call 911 and they'll help direct you.
Okay. Does anybody on Zoom have questions? I don't know if,
I'm just thinking-
okay. Right. If we don't have anything else, we'll talk about speech therapy specifically. So like I said, I'm a speech therapist here. I've been here for about 2.5 years. I work mostly on the acute rehab unit that Nellie mentioned. Sure, sorry. I work mostly on the acute rehab unit that Nellie mentioned. And then I also go to the acute medical floors, usually in the afternoons. And then sometimes I also do outpatients. So we have all 3 areas here. So speech therapy for strokes, or speech therapy in general, we're also called speech language pathologists, if you hear that word. We provide treatment for speech itself, language, cognitive communication, voice, swallowing, and fluency. And we're going to go into detail for each of those areas. So speech, how strokes can impact speech. It's called dysarthria, so meaning that your speech maybe sounds mumbled, or you have trouble getting enough airflow to speak for a long period of time, which might impact your loudness and intelligibility. So that's one area we work on. Strokes can also impact our language, and language encompasses everything from verbal expression to auditory comprehension, reading and writing. Is somebody trying to come in? I think we have somebody else. Hello. And this is called aphasia, and we'll go into more depth about that. Then we have cognitive communication, which encompasses like memory, problem solving, thought organization, executive functions. And we do a lot of strategies for that, helping people remember medications, how to pay their bills, and so forth. So then we have fluency, which can cause like a stutter. If you've ever noticed, people have childhood stutters. This is a stutter caused by a stroke. And then the last one, a lot of people, which honestly, most of the people in the hospital that we see have trouble swallowing after a stroke, which is not something you think of right off the bat. And this is called dysphagia, having trouble eating or drinking. So dysarthria, like I said, it's a speech disorder which is caused by muscle weakness following a stroke. Your speech may be slurred, you may talk too fast or too slow, you might be difficult to hear, your voice may sound really breathy. So treatment for that focuses on slowing down your speech, speaking in a nice loud voice, over articulating your speech to try to speak more clearly, and using good breath support, taking a nice deep breath, because often that coordination between our breathing and our speech is discoordinated. Any questions about dysarthria, or has anybody ever experienced anything like this? Trouble speaking if you've had a stroke, or know anybody that may have had that? This is a pretty common thing after a stroke. Yeah. Yeah. Okay.
No, I was very fortunate. I had my stroke here
Okay.
in 2015,
Okay.
and I stayed for an extra like 2 weeks, a week and a half.
Uh-huh.
But I had a heart attack. They weren't able to give me medicine.
Yeah. Mm-hmm.
So, but I've been very lucky. I didn't have trouble with thought processing.
Mhm.
Sometimes I still have. Recently, I started to have study.
Okay.
But when you finish the other thing, do you have any follow-up things? Because I was going to a book group
Uh-huh.
at Northwestern, but it coincided with another activity that
Oh, I see. Uh-huh.
Are there any other groups that are around to help you following up? Does that do things to help you?
Yeah.
Keep on participating in speech work?
I definitely agree. And those groups are awesome. Off the top of my head, the only one I can think of is where I personally went to graduate school, St. Xavier. It's on the south side. They do have different groups for different diagnoses, but I can definitely do some research on that. I think I've looked that up before for people. Maybe Rush has one, but yeah, that's a really great thing to do. I think it's also an option, if you've had a stroke a couple years ago, but then, more recently, maybe you forgot some of the strategies you learned in speech therapy, or things are changing for you. It could be good to get a referral from your doctor to go back to speech therapy. And it's, great to always review those things again, just to kind of practice strategy use to compensate for what's happening. And I'll have some more information at the end about that, but I'll look that up for you. No problem. Okay, the next one, the area that strokes can affect is our language, which, like I said, is called aphasia. So it's a language disorder following a stroke that can impact our ability to express ourselves. Sometimes people have trouble finding the word that they want to say. It's not that they don't know the word. It often gets confused with, other people or family members that like they don't know the word for water anymore or something like that. But it's just that maybe, the file system in our brain is kind of disorganized. Our brain doesn't know where to find the word. It has to take a different path there. So sometimes we have trouble expressing ourselves because of that. It can be as severe as like not even being able to express our wants and needs, or it can be as high level as just occasionally we don't know what word we want to say. So treatment for that includes using like communication boards if somebody's better at pointing to pictures of objects they want. Or like I said, like as high level as using word finding strategies. So if I couldn't think of the word for water bottle, I might talk around the word. I might say, oh, it's something that you drink. I might gesture and go like this. Oh, yes, the water bottle, of course. And then also like there's, more formal treatment to practicing like naming objects and things like that. It definitely varies from person to person. It can also affect auditory comprehension or difficulty understanding what others have to say. That can include like if somebody's trying to tell you to follow a certain direction or a command, or just even following along in conversation. So the way that we treat that is practicing following directions. We might do sentences with a target word. So like, look in the mirror, and trying to get people to fill in the blank, or just answering simple questions, yes, no questions, open-ended questions, things like that. It can also affect writing and reading. Usually these are the two areas we assess kind of later down the line. We want to make sure you can express yourself and understand people. And then we want to make sure you can also write, writing your name, your address, things like that. Signing your name, that's a big thing for people. And then also reading. Yeah.
That's not clear. So stop here and then share the screen. I just want to start that part.
Oh, I see what you're saying. Yep, sorry about that. How do new share? Here we are. Does that look better? Yeah, there we go. Thank you. So like I said, the last one is reading. How do I get this up? There we go. Making sure that we can, read, intake forms at the doctor's office, reading your bills, really functional things. Anybody have questions about aphasia in particular? Okay. No, it's not going to let me change it. Oh, there it goes. Okay. So our third area is cognitive communication, kind of a fancy term for how our cognition affects our communication. This can include our memory, our attention, problem-solving skills, executive function, and thought organization. A lot of times it's mostly memory, being able to remember names, what you want to do that day, directions, therapy exercises that you've maybe learned in the other therapies. A lot of times with stroke, attention is impacted in it. It's kind of funny how it presents. A lot of times your brain doesn't attend to one side of your body. Typically it's the left side. We call that left neglect. And actually I have a picture of when we assess cognition, we have people draw a clock, and you notice that they didn't draw anything on the left-hand side. It's like literally your brain is not attending to anything on the left side of the page. Ways that we help treat that is, using like a visual aid, like a bookmark, or scanning across the page, things like that. And then problem solving, making sure that we know what to do if maybe we're at home alone and we're not feeling well. What kind of tasks do we need help with in our everyday life now that we've had a stroke and things have changed? Executive function kind of goes along with that too, being able to plan things, reason, pay attention to detail. So like planning an event or going to an appointment. And then the last one is thought organization, kind of like our processing speed, how we can sequence tasks, things like that. Any questions about cognitive communication? And all these, or this area in particular can also be seen without a stroke too. So it doesn't necessarily have to be that diagnosis. Yeah. You have a question?
Yeah, that's what I want to ask. You don't have to have a stroke. You
Mhm.
have the cognitive
You got it. Yep. Yep.
Because, I have a friend,
Mhm.
she didn't have no stroke,
Uh-huh.
but then, I mean, she doesn't remember,
Mhm.
and she keeps looking in that building for things
Yeah.
that she just put there.
Uh-huh.
I mean, I'm like, you have cognitive, then she said, no, I don't have cognitive, but when I promised to bring her something and I forget, and
Mhm.
she said, see, you have cognitive, I said, no, I don't.
Yeah.
You know? So,
Yeah, a big thing with cognition is that a lot of the time the patient doesn't recognize their own deficits. So treatment does focus on that as well, like bringing it to their attention, but also showing them what they can do to address it, or having like family or friends be involved. So, if your friend wants to, go to speech therapy, that's definitely something that we can work on to help provide strategies, where to put things in the house so that you can find them easily. How can I manage my
I was
medications?
looking for a bank book, she just came from the bank.
Uh-huh.
I'm like,
Yeah.
"It's in there." No, I went
Yeah.
from here to everywhere, it's not there.
Yeah.
Forgetting stuff.
Yeah. So for example, with like things like that, or your keys, your wallet, your glasses, trying to put them all in one spot in your house in a basket or anything like that can be helpful.
Sure.
Yeah. Sometimes it's like simple things we don't even think of that can be really helpful.
Thank you.
Yeah, no problem. Anything else about this? Oh, like how we were saying, different diagnoses. So like if you have, a diagnosis of dementia, that can be what's causing this, or it could be a traumatic brain injury, somebody that's hit their head. There's a lot of different diagnoses that can cause this. Sometimes this is the first thing we see that leads to a diagnosis then too, because like, why is this happening, right?
But it doesn't mean that you're gonna have a stroke.
No. But strokes can cause cognitive communication deficits. Right. Yep. All right. Anything else about this one?
How does it affect the vision?
How do strokes affect vision?
So, there's a certain part of the brain that's responsible for vision, and it tends to be the back of the brain. There are specific arteries that provide blood flow to the back of the brain, or even the brain stem, that are responsible for those areas. So if vision is lost, and that might be the only thing, they will also consider a stroke, and it's usually related to either. It can be a stroke, or it can be related to age, or just a problem at the nerve ending responsible. So there's multiple things that can go into it, but yes, vision loss can be a sign of stroke, often related to a blood vessel having a clot or a burst blood vessel. It can also be other things, but they also will look at stroke.
Two other things you may see after a stroke. She talked about how they're looking in attention. That affects your vision field as well, so you may not see anything on the left. But your eyes are controlled by muscles, little tiny thin muscles throughout your eyes in each direction. And if your muscles are affected by a stroke, you may have weakness in your eye as well. You can work with therapists to treat that and try to retrain those muscles, but that can lead to blurred, double vision, and headaches.
Right. So we were talking about stuttering and fluency. So if you want to compare that to if you've ever heard a child stutter, sometimes this happens after a stroke as well, where we either have syllable or word repetitions. I'm sorry, were you pointing to something? No, okay. Either frequent syllable or word repetitions that kind of get in the way of what we want to say. So treatment focuses on using different strategies to try to reduce those dysfluencies. A lot of it is also about like it causes a lot of tension and frustration, and then that causes more stuttering. So treatment's kind of twofold there. Any questions about the stuttering?
That happened when my sister had a stroke, and 2015.
Uh-huh.
And this, she does that, when she gets upset, she'll stutter. So does that
Sure.
come later sometimes? Because it wasn't at the beginning.
Do you think it's because you're struggling to find that word that you want to say, like the water bottle, or, you know, like, are you using it as a compensatory strategy to give yourself some time before saying the word? That could be part of it.
It's definitely, I don't know.
Yeah.
It just happens like when I have to call, make a phone call to an appointment.
Right.
And maybe it's scary. You know,
Sure.
I'm
Causes a little
nervous
bit of
about it.
anxiety or something. Yeah.
And one of the nice things, I don't know if they do yet, after having the stroke in 2015,
Uh-huh.
last year, the doctor said 6 months ago, she said, I don't have to come back for you.
Okay.
And because the brain is forgiven,
Mm-hmm.
and I just think that people should know that too.
Yeah, sure. Of course.
But I still, a lot of times, like, I don't want to, I make my sister call.
Yeah.
She says she's me.
So something you could do, like, if,
It's easier to say
yeah, you guys do sound the same. Yeah. Something you could do if you want to try to be doing that yourself is to kind of practice with your sister before you call, to kind of let that stress and anxiety be a little bit lower so that when you go to make the phone call, it may not be as strenuous on you. But yeah, especially if you're interested in learning some different strategies, you know, we have an outpatient clinic here where we could review stuff like that as well.
That sounds,
Yeah.
because I always all these.
Mm-hmm. Yeah, like I said, it doesn't have to be a recent stroke, but sometimes we can review certain things that maybe you learned back when you had the stroke, different strategies that we could relearn now, and just kind of like a refresher course. All right, and then the last one is dysphagia or swallowing difficulty. Like I said, this I get this a lot in the hospital. Primarily, most of my patients are swallowing patients, so that could include, you know, difficulty eating or drinking, or both. Usually, it's both. So difficulty chewing. Maybe you have reduced awareness where you're holding food or drink in your mouth. Maybe you're having trouble managing your saliva, your secretions, or just like overall weakness that can lead to aspiration. And aspiration means when food or drink goes down to our lungs. And the reason we care about that is because that can cause things like pneumonia. The reason that happens is because if the food or drink gathers bacteria in the mouth and then it goes into our lungs, that bacteria can cause that infection. And pneumonia comes with, you know, a whole long list of complications. So we try to avoid that, obviously. We look for different signs or symptoms of aspiration. So like coughing or choking, frequent throat clearing, or like a wet voice when you eat or drink. So you swallow and then your voice sounds a little bit wet. So if you notice that you or somebody else that you know might be experiencing these things, it would be good to let the doctor know so that they could be evaluated by a speech therapist. And again, like you were saying, this also isn't only associated with strokes. This is associated with a lot of different medical issues. So this kind of applies to many different cases. Sometimes dementia, like we said, Parkinson's disease, multiple sclerosis, a lot of different things can cause dysphagia. Any questions about dysphagia? Yeah. Correct. Yeah, like if you have a stroke, you might experience dysphagia after.
Even if you don't have a stroke, maybe it's like a warning that you're about to have a stroke. Can it be a warning?
I feel like it's probably not the first thing that you see, but yes, it could be where like maybe you just all of a sudden have difficulty eating and drinking, but it's probably associated with some of those other more common symptoms that we see. Anything else about swallowing? So like I said, I was going to mention how like you can receive services. So if you or someone you know could benefit from speech therapy, you just need to ask your doctor for an outpatient referral, as you are all outpatients. If people are in the hospital, that's a little different. If you are interested in coming here, we have an outpatient clinic that offers speech therapy for any of the areas that we talked about. Does not have to just be associated with a stroke. That was the topic today. It's on the first floor near radiology. And then alert your doctor if you or someone else is experiencing difficulties in the areas discussed following a stroke, and include that reason in the referral. Yep, go ahead, Leanna.
What do I say to my doctor in order to get them to write the referral for speech therapy, especially if they're thinking about maybe physical therapy, but
Sure.
they don't think that I need speech or they're not.
I think it definitely depends what you're experiencing. So be very specific. If you've had a stroke and now all of a sudden you're having a really hard time remembering things, you know, a physical therapist won't be able to help you with that. And you could suggest to them, do you think speech therapy might be an option for me? If you feel like how you're explaining that things are starting to get harder for you and you're noticing some new deficits, explain. I don't know if you've previously had speech therapy, but I used to have speech therapy. I'd like to go back to speech therapy. New onset of swallowing difficulty, that could be something you present to the doctor, and hopefully they would recognize that that's a speech therapist's wheelhouse. Any other suggestions, Leanna?
I think that's good. That was just for everyone in this room who's very high level. We're out in the community. We're going to presentations, we're stimulating our brain, we're writing in our textbooks and paying our bills. We might not present like we need the services, so it helps to just have some ideas on what to say so that our healthcare providers understand that we have.
Yeah, could be good to start writing some of those things down, like specifically, I'm having trouble remembering to take my medications, or sometimes when I drink water, I cough. Keeping like a log of that so that you can bring that to your doctor, and then you have it written down too. That's a memory strategy in itself. So that you can kind of present the different things that you've been feeling, maybe not every day, but every so often. And then this is my contact information as well. Yeah.
Does Medicare and Medicaid cover your services?
Yes. Yep.
Yes, maybe.
Is it, did we print the last page? Okay, yep, so it's right in there. So this is my personal office number, the first one, and then you can also call the outpatient therapy department to talk to them as well. But yep, you can call me with any questions you have. We could do questions now. Anything else I can answer for anybody? Yeah.
Sorry, I'm late because of
Oh.
the bus.
Oh, that's okay.
What I really am interested to know is like when there's a stroke, right?
Mhm.
The left side, like I've done from the brain left, neglected. But why is usually, because what theory I learned was like if you're right-handed, you affect the left. And then I'm like, does it apply to everybody? Like, like if you are left-handed, will it still be your left, or if you are left-handed, the affected part will be your right? That's what I particularly want to know.
Sure. So strokes can happen on the left or the right side of the brain, or both. A lot of the times, if they happen on the left side of the brain, it affects the right side of the body. And then sometimes when it happens on the right side of the brain, it affects the left side of the body, like contralaterally. That's not always true, though. Sometimes it's the same side. I don't know if that's necessarily true with what dominant hand you have.
No, but.
No, yeah.
Not specifically, no. It all depends on what vessel in your brain was affected and what side of the body, unfortunately. Now, we do see that people are sometimes forced to use their non-dominant hand because their dominant hand became affected. So sometimes you are forced to switch. But if your stroke affected one side of the brain and the other side of your body was affected, it just depends on what side of the brain.
Yeah.
And most people recover and they go back to normal. Is it common for people to go to normal, like they were living before, all of a sudden they're running marathon or something. Is it possible?
It definitely varies person to person, right? Go ahead.
So the thing is, you gotta kind of conceptualize what we're talking about. The brain has lots of little blood vessels in it. When you have a stroke, an embolic stroke, one of these vessels gets a little clot in it and blocks that one blood vessel. It can be a blood vessel that controls your speech or your memory or weakness in your leg. If it's a big blood vessel, it's going to be a larger stroke. A small blood vessel, a smaller stroke. How quickly you start rehab and aggressively you do rehab will often predict how much recovery you get. You can get a full recovery or a partial, and it depends how big a stroke you have. Also, if you get into the stroke center early and they give you these drugs we're talking about are basically clot busters. And they'll break up the clot and stop the stroke while it's happening. That's why it's so important to get in early.
Unfortunately, during COVID, a lot of people were afraid, and we're still in COVID, but in the height of COVID, people were afraid to go to the emergency department. And we saw so many people that suffered strokes at home and just tried to sleep off the symptoms, unfortunately. And we saw a lot of patients had very severe consequences of that. And I understand, no one wanted to go to the emergency room, but it's still true. Time is brain. When you have any abnormal symptom that we talked about today, you have to get to the emergency room. Yep. Unfortunately.
Does the brain scan show those blood clots?
There's different types of brain scans. The initial scan that they do in the emergency room is just to verify that you did not have a burst blood vessel. Then they'll do more advanced imaging to figure out possibly where a clot could be. So that's a CT scan with contrast, and then they'll even do an MRI later to figure out what area was affected. Initially, what's that?
It will show up.
Initially, if your stroke is caused by a blood clot, it will not show up on a scan. It takes,
Not right away.
not right away. It takes 6 to 24 hours for damage to show up on the scan. Yeah. So basically, the doctors in the emergency room do a scan. If they don't see bleeding in the brain, then the assumption is you have a stroke caused by a clot. And then they'll give you the medicine. They're just, the initial scan is just to verify you didn't have a bleed. If that makes sense.
There's probably one other thing that should be mentioned. You suddenly get drooping of your face, or weakness in your arm. Oh, gee, I'm having a stroke. And then 15 or 20 minutes later, it goes away. You say, oh, it's nothing, forget about it. Don't do that, oh, it's nothing, forget about it. Reach out, because there's this thing called a TIA, which is like a miniature reversible stroke. And you have all the stroke symptoms, and then it goes away kind of quickly. Don't ignore it, get into the hospital, because that's a warning sign that you may have a real stroke coming up.
Mhm. Yeah, I think it's like almost 1/3 of people who had a TIA will later have a large
full-blown
stroke. Yeah, 1/3. That's a large number.
So it's not something you want to ignore, sort of have symptoms and then they go away and you say, it's nothing, I'm just gonna go back to sleep. Oh, it's nothing, I'm fine. Check it out. Be safe.
As we go into Thanksgiving, we want to be grateful for our body's warning signs, but don't take them for granted.
I'm glad you mentioned the TIA because people think of TIA as means they don't pay attention. Like you said, do not ignore the TIA signs because it might be the big one coming or whatever. So I'm glad you mentioned that. Because there's nothing like you stroke. Stroke to me, you know. Glad you mentioned that.
And I think it's good that now you all know about this. You can tell other people what you've learned. I think that's the biggest thing. One of the biggest takeaways is, tell other people about it so that they know what to do if they're having any symptoms of a stroke.
I want to speak a little about frustration.
Sure. Yes, that's a good point.
Not only the patient, but the family.
Yes. So like we were talking about, a lot of these deficits that come from a stroke can be very frustrating for people, especially being able to express themselves or like having to repeat over and over again because maybe their speech is a little too mumbled, imprecise, and that can cause a lot of frustration.
The patient knows that they want to get the words out,
Correct.
but they can't get it out. And they
Right.
recognize it.
A lot of times patients will say to me, oh, I feel so stupid. People think I'm dumb. And those terms get said a lot. And I think one of the harder things is that, especially when you're going in public or like you said, talking on the phone, there's a lack of understanding of what a stroke is. So any chance you get to educate somebody, hey, I've had a stroke. I have trouble expressing my my thoughts and feelings. So if you could just be a little bit more patient with me, that would be great. And then the impact on the family. What you can do as a family member, if you have somebody in your family that's had a stroke, be very patient with them. You're kind of like their therapist when they're at home, right? So kind of mimicking what we do in therapy, allowing them to try first before you give them the word. Or if you know what they want to say, give them the clues to say it. And I think patience just goes a really long way for people. If we're talking about memory, trying to set them up with a pill box, or like I said, like one little basket at home to put all the important things in, trying to set them up for success, especially if they live alone. But yes, a lot of these deficits unfortunately cause a lot of frustration. But I always involve the family to provide education on why it's happening, because I think a lot of the times people think the patient isn't trying, when that's the complete opposite. The patient's actually trying very hard. So yeah, good point. Thank you. Anything else? Okay, well, thank you, everybody. Do you want me to stop it, Judy?